often get asked the question, you know, what has creativity got to do with health? You know, where does creativity have a role in health? Because people who aren't in health communications, I think, see it as this slightly dull, very regulated kind of area of the world that you can't possibly be creative in, and I think it's exactly the opposite. So I am very excited about anything that raises the profile and the sort of bar, if you like, for creativity in healthcare comms, and the Cannes Lions are going to do that more than I think probably anything else has for a number of years. Having worked in healthcare for almost all of my adult life, which is about 200 years now, I think health, people don't understand health. We sort of laughingly refer here in Edelman to it sort of the Republic of Health, because I think that's often how health practices that are part of bigger organisations are seen. You know, they're the geeky kids in the corner. We don't quite understand what they do. They do something terribly scientific and important, but it's completely different to anything else anyone else does. And in many ways it is, but in many ways it's not. And where I get the most buzz actually is working with my colleagues in other practices, especially because they generally are much more comfortable in a sort of creative space than perhaps healthcare practitioners. And I think we often let ourselves be typecast almost by the regulations around us. So we think, oh, well, you know, we have to be, you know, we can't be creative. We have to be very sort of staid and very sober about things. And yes, you do, but that's where creativity, I think, actually has more to offer, because if you can do it in that environment, you can do it anywhere. And that's the real challenge, is bringing creativity into such a heavily regulated space as healthcare. We have clients often say to us, we'd like you to come back to us with something really creative. And it's sort of creative is almost in inverted commas. And of course, being creative means different things to different people. But so we'll go away and we'll come up with something that we think is, you know, quite different, and maybe something totally innovative that they haven't seen before, and is maybe using a mix of channels that we would never normally recommend. And we'll go to them. Now, some clients will go, great, that's terrific, we love it, let's see how we can. And others will go, that's lovely, but we can't possibly do that. And there's a lot of the but we can't possibly do that, I think, that happens automatically. And I think what we need to encourage people to do is to not do that. No, we can't do that because we're in health and because of the regulations. We need to say, right, let's look at it the other way. Could we? How much can we do? And let's try and push it. What I'm hoping to see is just some really great creative work, and really see people who are able to push those boundaries, you know, those regulatory boundaries, and also the client mentality boundaries, safely and effectively within regulation, but do some stuff that, you know, hasn't been done in healthcare before. And saying it, you know, doing things that haven't been done in healthcare before may not be, you know, it may not be the groundbreaking, earth-shattering, you know, taking over a country to launch product kind of stuff that wins awards in other categories. So that's going to be an interesting dynamic, I think, to see how that works. But just to see new and different ways of doing things.